Hello everyone, welcome back for another Mental Health Awareness Month tip. This week what we're talking about is how to access mental health services, how to go about getting in touch with a therapist and starting the therapy work, because sometimes this is the hardest part. If you're not sure, if you've never really accessed mental health services before, never done therapy before, then you can kind of be lost as to where to start. So I'm hoping today that I can give some educational tips that will help anyone who's considering that therapy might be helpful to them. Some tips on how to go about beginning that process. Again, the goal of this month's weekly Facebook Lives is to spread awareness and education to end the stigma that's attached with mental health services and mental illness, and to spread a broader and more accurate understanding of what mental health is. So last week we talked about some reasons why someone might need or benefit from therapy, and this week we are talking about how to go about getting those services. So the first thing I'm going to encourage you to do, if you have decided that therapy could be beneficial for you, is to put in your own words what you feel like you're struggling with. So just kind of sit down and reflect over the recent couple of weeks or the past month and think about what are the things that have been the most difficult for you. Where are the areas that you have struggled most? What are the things that you find that you just don't have enough in your toolbox to cope with in a way that doesn't feel like you're unable to bear the weight, like you're breaking under the pressure? So identify what those things are. The difficult part of this is that sometimes we as therapists use a little bit too much of the therapy-y language, and so to find a specific therapist that works with the struggle that you're having could be difficult if they don't have kind of the everyday wording listed like on their website, or if they don't advertise themselves in that way in the newspaper or wherever you might be, the phone book, wherever you might be looking for them at. So one of the things that I try to do is to kind of put things in the words that we all use every day. So instead of saying that, I help people with post-traumatic stress disorder, while many people might search for a therapist that works with people that are struggling with post-traumatic stress disorder, a lot of times what we are looking for is someone who helps when these bad things that happened in the past keep coming up in today's life, in your thoughts and your feelings and your relationships. And so put into words what your struggle is, what you're hoping to work on in therapy, or what you think a therapist could help you with as the first thing when you get started with beginning the process. The second thing that I would encourage you to do is, if you have a primary care doctor, so just your general medical doctor that you see if you have the flu or you see for your routine checkups, if you have one of those, then set up an appointment with them and talk to them about some of the struggles that you're having. If you're struggling to put it into words that might be searchable, like online or something like that, they could help you do that. They could also help you have a better understanding of what specifically your struggles might be related to. So maybe you're noticing that you isolate yourself a lot, that you've been spending a lot more time in your bedroom and not out with the family, or you've been declining a lot of social gathering invitations because you just don't feel like you have the energy to keep up with the social experience that might be going on there. Maybe you find that your energy level is really low and you're just not enjoying things that you used to really enjoy, like a good book or a certain TV show that you like. And when you explain that to your doctor, they might suggest that there seems to be some depression symptoms going on. That makes your job of searching for a therapist a lot easier, because you can search for a therapist that helps with depression. The other benefit of talking to your primary care doctor is that they might, and most likely, already have therapists that they have worked really well with, that they've seen people get really good results from working with, and that they have kind of a professional relationship with, that they could give you some insights from that perspective. So meeting with your primary care doctor allows you to also work with a therapist that might already be connected to them. It is really helpful when your therapist and primary care doctor, or even your psychiatrist if you already have one, work together and can kind of correlate all of what they're doing, combine their treatments to be the most effective for you from a holistic perspective, so an all-around approach. So work with your primary care doctor if you have one. If you don't have a primary care doctor, then I would suggest you get one. Meet with a physician regularly just for your routine checkups. But if you don't have one, then you can go about searching for a therapist on your own. And even if you do have a primary care doctor and they don't have a specific therapist that they would recommend, or they have one, but you would like to find other options, there's some things you can do to search for a therapist that might best fit your needs. So one of the things that's most important in finding a therapist to start working with is that they are a good, what we would call a good fit for you. So you're looking for someone that meets your personal needs of working on therapy goals. So some of the things that people consider sometimes is, do they feel more comfortable talking with a male or a female therapist? Are they looking for a therapist that's trained in a certain type of therapy? So maybe you have heard from someone who struggled with something similar to you, that they did a certain type of therapy and it worked really well for them. So maybe you're struggling with some traumatic stress symptoms. So maybe there was some abuse or a traumatic incident that happened in your life, and it keeps kind of popping into your mind and into your feelings, and it keeps coming out in your relationships over and over again in the present moment. And you have a friend who says they did this type of therapy called EMDR. And so you want to try that type of therapy because maybe you've tried several other types of therapy and they weren't as effective for you. So you might look for a therapist that's specifically trained in EMDR that would be the best fit for you. Another thing to consider is, do you prefer a particular style of therapist? Do you prefer a therapist that does a lot more listening than giving feedback, or vice versa? Do you prefer a therapist that's willing to use humor, that doesn't make the entire therapy session super serious all the time, but still gets work done? Other things would be, have you had therapy before? This is one that I hear often. Have you had therapy before and you felt like the therapist shared way too much of their personal experiences, or you had a therapist that seemed to, from your perspective, take things very personally? I would encourage you to talk to the next therapist that you would be seeing about those things. Really generally from a best practices approach, as therapists, our job is for the entire focus to be on you, and we have very little from the perspective of offering and sharing our personal experiences or opinions or advice to the therapy process, because those things just generally aren't the most helpful. What is most helpful is the education, the skills, the training pieces that we have received throughout our educational experience that we can offer you. So I encourage you to talk to a therapist about those particular things that might be best fit needs for you. The other thing that could be an important fit issue is kind of the financial part. Are you wanting to use your insurance? Are you able to do self-pay, where you want to just pay out of pocket for the services that you're getting provided to? That's going to be an important thing for you to consider in terms of who's the best fit therapist for you. One way to go about finding a therapist, if you have a need of a therapist that works within your insurance company, is to contact your insurance provider and ask them what in-network therapists that they have. And then you can look up each of those therapists and kind of find the one that best meets your needs. So identify what your struggle is. Talk to your doctor if you have a primary care doctor. Get some recommendations from them for therapists that might work well with you. Determine what your fit needs are. So determine what type of therapist or what style or what needs from a therapist you have. So then the next thing that it would be important for you to do and helpful for you to do is to start searching for those therapists. So maybe you're going to search the specific names of the therapists that the doctor provided you, or maybe he provided you with their business card that has their website information on it. Perhaps you are going to search for the therapist that your insurance company provided information about, and you'll search for their website. Or if you don't have any of those references to go from, you can just search from your own information for a therapist. So I'm going to kind of turn this around and give you an idea of kind of how to do this so that you can see how to go about finding the therapist that works best for you and can best meet your needs. So if we look here, we're just going to do a basic Google search of, you can see what I've put in the search bar here. We're looking at the Holton, Kansas area, so Holton, Kansas depression therapist. And if we just search that, we're going to come up with several options for depression therapists. So we have 3 options here. 2 are the same because Google doesn't change things very often, and so that's still waiting to be changed. But in the Holton, Kansas area, directly in Holton, we have these 2 options. So you can see that each of them have a website that you can visit to get more information from. Of course, you can always go back to kind of the old school, look in the phone book, and maybe even talk to friends about what therapists could be helpful to you. But today we have this great advantage of the internet, and we can get so much information that is very helpful in making the most informed choices. So if your therapist options include therapists that have a website, that is definitely a bonus because you can get a lot of information about them. So we'll just go to my website, and you can see here the information that you could access. So most therapy websites are going to have some information that is along these guidelines. So here we have the homepage where if you scroll down, you see some options for contacting. There's almost always going to be this welcome piece here. I actually encourage you to really read that for the therapist that you're looking for. What we try to do here is give you an idea of who we help and how we help them. And I would encourage you to kind of think, do I see myself here? Do I feel like this is actually talking to me? Because that might be an indicator that that therapist is one that could work really well for you. So on my website, many others will have the same. You'll have all the contact information down here where you can message, email, call, so that you can ask questions. A lot of times the website itself will have a lot of information available where you don't even need to call. I know sometimes that can be an anxiety-provoking experience for many people. So you wouldn't even need to call if you just wanted to look for, okay, get help for, does any of this fit my needs? Am I wanting to get help for anxiety or depression or relationship struggles? Am I wanting to get help for trauma stuff or PTSD recovery? And if so, then I might look at that page and see what that means. So there's going to be some education here about what that trauma PTSD recovery means, how you might know that that's what you're experiencing, and how that therapist might be able to help you. Other things that you could find on here is you could see the type of services that they offer. So there's individual therapy, couples therapy, group therapy, that there's some steps to getting started. So if you click the Getting Started page here, it's going to immediately bring you to request an appointment, which would be the first step in getting started in therapy. So you can also look at getting started in rates and insurance. This might be helpful information for you if you want to find out what the rates are, what insurance companies that therapist is in network with, some information about what to expect, how to contact your insurance company. Another important piece of information that you can generally find on a website for therapists is the About page. So the About page is going to give you information about that particular clinician. So some important information that might be helpful for you to know is like what their licensing is, what their degree and specialty areas are, what types of therapy they are trained and experienced in providing. Again, if you were looking, if you had looked up depression and you found out that the best and most recommended treatment for depression is cognitive behavioral therapy, then you might want to be looking for a therapist that provides cognitive behavioral therapy. Also tells you a little bit about their style, kind of what you could expect in working with them as a therapist. You want to make sure that you're working with a licensed therapist. That is a therapist that is licensed by the state of Kansas and regulated by the Kansas Behavioral Sciences Regulatory Board to ensure that they follow all ethical and legal standards. Might also give you some information about some particular trainings that they have done or some memberships, so you can see kind of certain memberships that might meet your particular needs, and some information about kind of where they might be featured. Another helpful tip of information that you could use from a therapist website, of course you can always use the contact information, but is their blog. I find this to be a really good way to find a therapist that's voice is the one that you will be most suited to in your actual therapy sessions and work when you meet with them. So you can look at their blog and read what they've written and read what they have to share and see, does this seem like the information that I'm looking for? Does this seem helpful to me? Does this seem like this could be a helpful therapist for me to work with? A lot of therapists will also have their social media information on their website, so you can check their YouTube page out, their Twitter, Pinterest, or Facebook page, or their Instagram pages, and see, if you get a feel from those, if that is a good fitting therapist for you as well. So all of this is for you to find the best therapist to meet your needs. This is how we just Googled a therapist based on location. So we put in Holton, Kansas depression therapist. So location, what your struggle is, and therapist. Another option that you can do for searching for a therapist is look at psychologytoday.com. This is a website that gives a directory of all the therapists that subscribe with them. And it's really easy to search information on this type of a site. So if you go to psychologytoday.com, you click on Find a Therapist, and you just put in your zip code. So we're going to use the Holton zip code of 66436, and you search. And it's going to pull up all of the therapists in the Holton, Kansas area. Now, of course, it's going to bring some that are actually in Holton, and then it's going to bring some options that are just near Holton. So you just need to decide, if you're able to travel. Are you able to go outside of the Holton area? It'll also give you some more, options for cities. Another good thing about Psychology Today is you can search by insurance company. So if you are using Blue Cross and Blue Shield insurance, you can search for a therapist in the Holton area that takes Blue Cross and Blue Shield insurance as an in-network provider. If you're looking for one in particular that helps with anxiety, you can add anxiety as another search option. So now you're looking for therapists in Holton, Kansas that are in network with Blue Cross and Blue Shield and help people with anxiety. And here you'll see that you can view their profile. It's going to give you a lot of helpful information about what they help with, what struggles that they might help people work with, what types of therapy that they do, rates and insurance that they might be in network with. And then you have the option here of clicking their website and linking back over to find even more information about them. Even if you get all the information on Psychology Today, it's still really helpful to visit their website because you have those options on there about like with looking at their blog and finding other specific information about their practice. So Psychology Today is a good option for looking for a therapist in a more directive way that has all the options for searching. Another one is goodtherapy.com. So if you just type in goodtherapy.org. So goodtherapy.org, then it will give you the same type of option. You're going to look at this section that says find the right therapist, enter your zip code. So we're going to do 66436 for the Holton zip code, search, and it will bring up a variety of therapist options for you to consider. So it's going to tell you, again, some information about them. You can search for specific things that you're looking for, again, like if we want to look at therapists that provide in-network services with Medicaid that assist people with depression struggles, then we search those options and we find here are some options. So again, we're looking at therapists in the Holton, Kansas area. This is not all the therapists in the Holton, Kansas area. There are other therapists. They're just not necessarily with Good Therapy as their registry. So this provides some other options for therapists that are close to the Holton, Kansas area. With these sites like Good Therapy or Psychology Today, one of the good things about finding a therapist on here is this thing right here, is that it's an option to find a therapist with verified credentials. So that means that this registry, goodtherapy.org, or Psychology Today like we looked at before, has verified this therapist's credentials, that they are a credentialed therapist. They have a license, they have training and education that allows them to ethically and effectively provide good therapy. So those are some options for how you might search for a therapist might be the best fit and the most suitable to your needs for therapy. In addition to kind of looking at those websites and searching for that information. The next steps are just as important. So now you've found maybe a couple of therapists. Maybe you found 3 on those websites or in your Google search, or 1 from your doctor and 2 from those sites. And you've looked at all 3 of their websites and you think that any of them could be very helpful to you. The next step I would suggest you do is to contact them. So message them, give them a phone call, and ask them if they offer like a free phone consultation. Many of us do, just so we can make sure, like for me personally, providing a phone consultation or even a consultation over messaging. And as a side note, the messaging option that I provide is because I know for many people making that phone call is very difficult. So if it's an option for you to message me in a secure manner through my website, and you can type out the information and it feels a lot more comfortable and a lot easier than speaking it out on the phone, I want you to be able to do that, because I don't want there to be any barriers for anyone getting services that could be helpful to them. So ask the therapist if they provide a free phone consultation. And generally we'll provide like a up to 15-minute phone consultation where we'll just talk to you about kind of what struggles you've identified that you'd like to work on in therapy, what type of therapy we provide. You can kind of get a feel during that phone call if this person is a good fit for you. And if you feel pretty comfortable in that first phone call, you can go ahead and schedule the first session, which is generally an initial intake evaluation. So I call that an interview. And that interview is for the therapist to get to know as much about you as they can, to determine if they are the best therapist to meet your needs, and to identify kind of the specific struggles. So if you were doing an initial intake evaluation with me, part of my goal in that first session would be to determine if there's a diagnosis present, and I would use that as a helpful guide for what therapy might look like. What I'm considering in that is if there's this struggle or this diagnosis present, then there is a bunch of psychological research that has been done that says these types of therapy or these types of interventions are going to be the most helpful to resolve those struggles. And my goal is always to be using the best evidence-based approaches because those are what are going to get you kind of the most bang for the time and energy and investment that you put into therapy. So that would be that first step after making the phone call or sending the message, that you would do that initial intake evaluation. And in that evaluation, you're going to be looking for a few things. Do you feel comfortable with that therapist? Do you feel like they're a good enough fit that you could do good, helpful work in therapy with them? You might also inquire about specific types of therapy that they would recommend that are evidence-based and have been shown in the research to be effective in helping the type of struggles that you're looking to work through. If you don't find that that therapist that you meet with in that initial intake evaluation or that initial interview is a good fit for you, if you feel like there's just not a good clicking of the personalities, then I do encourage you to kind of shop around, meet with another therapist. I would rather someone let me know that in the first session and I help them provide a better fitting therapist for them so that they can get the most out of the time and the energy that they're going to invest in therapy, not just working with a therapist that's good enough for them. So get a good idea in that first session of if that person is the best person for you to work with, and if not, move on to the other options on your list. The good thing about having those search options like a Google search or the Psychology Today or Good Therapy search is that you can generally get several options for you to consider in working with a therapist that might best meet your needs. The last suggestion I'm going to give you about how to access and get involved in therapy services is to be sure to start therapy with your therapist with a specific goal. If you go back to some of the blog and Facebook posts from earlier in the year, we talked about setting goals, and one of the things that we talked about was setting SMART goals. So SMART being an acronym that stands for specific, measurable, attainable, realistic, and timely goals. So I'm going to encourage you to go into therapy with an idea of a goal that the therapist then can help you make into a SMART goal. So something that's very specific, that you will be measuring over the course of therapy, that is attainable in the time of therapy that you're wanting to commit to, that's realistic for you personally, and that's timely. So my encouragement for people when I start working with them is to know that we aren't going to plan to do therapy just for however long it takes or just forever. We're going to set a specific time frame that we're going to work on a certain number of goals, and we're going to measure them at a certain time frame throughout the course of our work to make sure that we're making progress, and so that we know when our goal has been reached and when is a good stopping point for graduating out of therapy. So I hope that this information today has helped you know a bit more about how to go about accessing mental health services, how to go about finding a therapist that is the best fit therapist for you, how to identify the needs and the fitness that you have for therapy, and how to begin the therapy work with a focus of a specific SMART goal. I hope this is helpful to you. I hope this helps to spread awareness and accurate education about mental health struggles, and about accessing mental health services. I encourage you to share this live post today using the hashtags that are in the post of hashtag MH Mental Health Awareness, or hashtag MHAM2018, or if you're in the Holton area, hashtag Healthy Holton, so that we can spread awareness and education to the broader population and end the stigma that's been associated with mental health and mental illness. I hope you find these helpful. I will be coming again next week to you on Tuesday at 9 a.m. for another educational health fact about mental health. I hope you all have a great week.